I'm Dr. Chris Nicholas, and here we are at Great Lakes Medical Imaging. Welcome.
John, where are you?
Old man's touching me. My name's Dr. Chris, and I'm an interventional radiologist.
Hi, I'm Dr. John, and I'm an interventional radiologist.
Interventional radiology is doing minimally invasive surgeries using image guidance.
We do several procedures through small incisions with local anesthetic. We do it usually in an office-based setting.
We keep patients out of the hospital and get them home as quickly as possible.
So we're here again at Park Club Lane, our outpatient facility for Great Lakes Medical Imaging. Today we're doing some musculoskeletal, or musculoskeletal as the Canadians say, types of interventions. So patients who have aches, pains, there's all sorts of different things that we can do from a pain management standpoint, back pain being one of the more common things that we see.
One of the things we do is a treatment for back pain, which a lot of people don't know about, but it's called an RF or radiofrequency ablation.
1,001 different causes for back pain. In this case, we've identified in these patients that the facet joints, a few of them are problematic and are pain generators for the person. We've actually already done medial branch blocks on these patients, which are temporary nerve blocks to ensure that, yes, this will give them pain relief. And once we demonstrate a consistent pain relief with those, then we can do the more permanent solution, which is the RF ablation or rhizotomy.
Every patient gets a different response. Some patients get 6 months, some patients get a year, some patients get up to 2 years response. But in the event that it comes back, we can always just retreat them.
So there you go. We'll take you into the case, show you exactly how that's all going to work. And then we'll go interview Dr. Jim Rinaldi. So one cause of lower back pain is arthritis in some of the small joints called the facet joints. And one of the ways we can treat that is we can do nerve blocks for the nerves that supply those joints. What we'll usually do is something called a medial branch block. Once we confirm that that improves the patient's symptoms, then we can do a more permanent solution called a rhizotomy or a medial branch nerve ablation. So that's what we're doing here today. So here are the needles that we use. They have a little curved tip on them so we can steer them a little bit easier. We'll place the needle first, take the center stylet out, then give some local anesthetic, and then we put our probe down through. And the probe will actually heat up the tip of the needle. And that's essentially how the ablation works. It uses radio frequency energy, essentially vibrate back and forth, RF energy, and that's how it creates the heat. It's a thermal ablation.
I'm so excited to see Dr. Nicholas. That's kind of hurtful.
Electrodes in, probes, and we're first going to do tests to make sure that there's no nerves that will be damaged that would cause any motor deficits. Obviously, we only want to change the sensory, we don't want to change the motor. The freezing going in now, you might feel some pressure here. We've tested and made sure that there's not going to be any problems with the motor nerves that supply the legs. That's obviously one of the more serious complications. You don't want to ablate a nerve that causes decreased function of the legs. We just want to ablate the nerves that cause pain to the backs. Tested all that, everything looks good. Now we're doing the ablation here, you can see on the machine.
45 seconds, you're all done.
We're done.
Just get a...
You're solicited everybody.
I'm your only subscriber.
That's right, we have one. This is Joe Macy, our rep with Abbott. He helps to support our cases, and he's been really helpful getting things going, so we're appreciative to have this, Joe.
That's great. A lot of fun. These guys are great.
He has to say that, yeah, he has to say it.
Say that, sounds good.
All right, thanks, Joe.
You got it.
Get her!
That's how she started her day.
That's her.
I don't feel well anyway. I hate both of you.
You didn't see me until the last minute either, which was awesome. You didn't hear me running.
My reflexes are a bit slow today.
Do you need help with your key?
No, I don't need help.
Okay, go ahead, honey. We'll help you out.
Hi, Becky.
Chris has got your breakfast.
Becky,
Come on.
I miss you. And Becky, your husband said you don't ever come see me because I intimidate you.
That's not true.
I feel the same.
Because I feel so bad because these jokers are always coming in here disrupting your day. I don't want to be that guy.
These jokers.
These jokers.
Here's your breakfast, boss.
It's so magical. That was awesome.
Hi. Good morning. What
I hate both of you, she
procedure?
said. I hate both of you.
What procedure are you doing today?
We did a rhizotomy.
Gary was so in his element.
Oh my god, he
Oh my
was
God, I was
amazing.
going to tell you that.
Wasn't he incredible?
Yeah.
He
That's
took
his
control of the
zone.
whole room. He's
Yeah.
just like, Chris and John, please, just
Step
hold
aside.
the comments for now. We're gonna
That's
take
his zone.
He loved it.
He had a spiel.
Yeah. Oh, he had it down.
Yeah.
If you feel anything in that right leg, you tell me right away, okay?
You actually like singed something in the back, don't you?
Singed.
Singed, barbecued, roasted.
We got. I wanted to make sure that you weren't somebody who can't know about this.
We have an older partner in our group. I hate calling him older. More mature, like Chris calls me. He was one of the founding partners in the group. Ton of personality, great guy, bit of a prankster. So we wanted to try to prank him back.
He does a lot of the imaging studies for the Buffalo Bills, the Buffalo Sabres, where some of the sports teams around here. We got the mascot from the Sabres, Sabretooth, to be a patient.
Rinaldi called me last night and said, because we had told him that we were going to interview him for the vlog, and said, like, what should I wear? What outfit should I wear for tomorrow?
Oh, that's sweet.
I can't wait to see the punishment in his eyes. It's going to be great. He does do great things.
Yeah, and I think it's important to sort of show what our group does. In addition to just interventional radiology, you guys only see procedures that we do, and we have a whole other diagnostic side that is even larger than what we do.
It is very important, but horribly pathologic that I decided to use that as a way to prank him. It's really, really high-end pathology that they've created. They really are heavily depended on by our orthopedic surgeons to accurately interpret the musculoskeletal. That's another word for sports radiology. We call it musculoskeletal radiology. So we're lucky to have them, but I am going to take full advantage and punish him today. So
without further ado, we'll go interview the infamous Jim Rinaldi. Let's go.
How are you?
Nice to see you. Nice. One day you're going to meet somebody.
Watch his hands.
So this is Jim Rinaldi. I'm going to start this interview with one question. Why do you call me Biebs?
Because he looks like Justin
You
Bieber.
look like
That's
Justin
why.
Bieber.
He's about the same age.
I get stuck because
Because then he started calling me
Johnny
Biebs.
Boy started calling you Biebs. Now everybody just calls
No one told me why.
Even the text, because you're just Justin Bieber, man. His
Sticks.
hair is perfect, and he's Canadian, so it's perfect. My graduate training was at New York University, where I'm a New York native. My medical school training was at Georgetown University Hospital in Washington, D.C. Well, my radiology residency was Georgetown University. My radiology fellowship was Georgetown University. A person who is a partner of mine right now, Dr. Michael Silber, was a resident with me at Georgetown, saw an opportunity here in Buffalo back in 2003 with the vision to grow a practice, and invited me up here, and eventually I accepted, and the rest is history.
So talk about.
Just for reference, I graduated high school in 2003.
Thank you very much. Now you want to call
Surprisingly, Chris had to jump in front of me like he always does with the lighting and everything else.
That's exactly
He
right.
wants to steal the
'cause
whole camera.
He wants the camera all to figure out.
Yeah, he does.
It's
He
unbelievable.
does. We call it musculoskeletal radiology.
Yes.
Most people don't understand that, but
Yes.
really, I just call it sports radiology.
Yes. You have to be a general radiologist first, and then you pick a niche that you like and that you're good in, reasonably good in, like these two guys do in interventional radiology. They're both fabulous. But my niche here with two of my other partners is musculoskeletal radiology, which entails the imaging of joints, knees, shoulders, ankles, feet, backs. And that's what I like doing most. I love anatomy. I was always good in anatomy. So, and once you know anatomy, it becomes easy and becomes very enjoyable. By coming up here, because of the two sports teams, we became involved with the Buffalo Bills. And now it's morphed into this. It's 10 years later, and we've been doing it every single year. We have a great relationship with them. I think if you asked them that, they'd say the same thing. As far as the Bills go, they trust us, obviously. It's become more complex with the advent. You're dealing with million-dollar athletes, and it's something we don't take lightly, because you're basically reading studies and helping make a decision, or helping the clinicians, who are the orthopods and the neurosurgeons, make a decision based on what we find and what we say in conjunction with what they find and what they say, to put this guy back on the field or to hold him out.
This means that they're going to surgery or not a lot of times.
A lot of times it means they're going to surgery. What's the treatment? Is it conservative treatment? Are they going to sit? Are they going to play? It's sort of like a concussion. We do some of that work, but we're not really into the intricacies of it. But
One second.
Yeah, what's up?
Hey Doug, we got a head on Saber.
Really? This will be good.
No.
This will be good. Good
Let's
footage,
see if we can.
Let's do it.
It's good
Let's
B-roll.
go.
Let's see if we can film it, because you can
This'll
see
be
in
good.
action.
Yeah, this will be good. This will be good.
Justin,
Where's this guy? Get your light and stuff. Let's do the B-roll.
It'll go perfectly with the interview, actually.
Oh, is he?
He's like a real deal.
The guy's the real deal?
It's
The
a
guy's
Saber.
pretty high-end.
Yeah, yes, absolutely.
You know who he is, though.
Yes, I've met him
You'll
personally.
be playing with him next year.
This is lidocaine, numb the skin, so it mitigates the pain of the injection. After all, we are putting a needle in somebody's skin and their groin, which can be very sensitive. Now, this is contrast to confirm that we are in the joint. You just have to keep track of what you're doing. It's sort of like making a recipe, if you will. I'm not sure about that. I'm not sure if the
Hey bud, we're all set whenever you are.
You pieces of Oh my God! I was set up. I was set. Who is that?
It's Sabretooth.
You guys suck. Justin,
Don't blame me.
Come on, stay close to Sabretooth. Come on.
Okay.
What do you think of all this?
I think this is fabulous.
We obviously love this guy because we took the time to put this together to prank him.
I think this is fabulous. This is beautiful.
I'll definitely pay for this later.
My blood pressure went up.
Everybody was on board in the whole building.
You knew it, Ashley. You knew it too. And you're behind this too. I will get you too.
Hey, should we go? Let's go get Virginia.
Yeah, let's do it. Yeah.
Right here, grab a seat.
New CEO.
First things first, I think you should fire Chris.
He's dead. He's dead.
So this is really awkward, but you've been replaced.
There's no better replacement.
Listen, he's
so handsome.
Sabretooth is very qualified.
Oh my gosh, I give the best hug.
It's just like the children at the games.
That was easy.
It's so awkward with Sabretooth. I love it.
I've never thought it would have this impact. It's awkward. Not the type of saber I thought I'd be with, but here we are. The story of my life.
Perfect Monday.
Hi.
I to give you a big hug.
Hi.
That just made my day.
Yeah.
Like, hello. Jeez.
You nailed it.
Did you ever think anything was going on at all in this whole process?
Never, ever
Not
once. He comes out of there, I'm like, what the hell is going on?
That's the big prospect.
Justin's the one who sealed the deal.
Oh yeah, he was
Because he
great.
told me who it was.
We really value Dr. Rinaldi, and he's actually a lot of fun to work with. And I think doing something like this really brings energy to the office, keeps things kind of
it does.
exciting. But we love Dr. Rinaldi. He's a lot of fun,
Thank
and
you.
I'm so glad that I'm up on. I got one up on him.
You're the man. Give me a hug, man. I'm a hugger.
Watch his hands.
We need more of this here. This is beautiful. This brings the youth and the energy. Is that the response you expected?
I thought you were gonna look at me and be like, beep, 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 beep.
Well, there was a lot of beeping that day. I went to Justin. That was beautiful.
So another exciting day at Great Lakes Medical Imaging. We got to learn a little bit about Dr. Rinaldi and what he does, and we got to prank him. So
Yes, it's been a wonderful day at Great Lakes.
So this is Dr. Rinaldi. I'm Dr. John.
I'm Dr. Chris. See you on the next case.
He is gonna try and get revenge on all of us, so we'll see how that goes. Just felt so good to get
Because
Rinaldi.
he's constantly stirring the pot.
He is
all day.
constantly stirring the pot. The jokester. He tries to one-up everybody else, so it was nice to finally get him. I'm pretty proud of myself for
I will
getting
say
him
that
back
you,
here.
he said
The
that he
link.
looked at you. He said, I've seen Justin completely serious only a couple times, and this was one of the times. You were completely serious the whole time.
I knew the F-bombs were coming.
Bring it, Jimmy.
He can bring it.
You can't top Sabretooth. You can't top it.
Yeah.
Should we end this vlog with a jump high five? A freeze frame?
3,